Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Cough syncope. If the patient develops in cough syncope, if the patient develops syncope after a long period of coughing, then it is called as cough syncope. Why does the patient develops cough syncope? It is because whenever there is raised intrathoracic pressure, this raised intrathoracic pressure will reduce the venous return to the heart. So, whenever the pressure in the lungs or in the thorax increases, this will decrease the venous return to the heart, thus decreasing the cardiac output. Thus, it will decrease cerebral hypoperfusion and syncope. So, because of decreased cardiac output, the blood flow from the heart decreases, the blood flow to all the organs decreases. When the blood flow to the brain decreases, then it results in syncope. Nocturnal cough.
thank you and thank you for watching.